Are you looking to get the most out of your Medicare Advantage plan, also known as a Part C plan in 2024? Well, here are some tips and tricks to help you maximize those benefits. Tip number one is make sure that all your providers are in your carrier/plans network. The two most popular Medicare Advantage networks, and you'll see the graph here on the screen, are an HMO and PPO. The short version is HMO is a very restrictive network. It will give you more benefits generally in the plan, but it's more restrictive when it comes to seeing your providers. And unless it's an emergency, you either will be denied service altogether or you could pay everything out of pocket. A PPO is more generous when it comes to going in and out of the network. So if I go in the network, that's the lowest pricing possible. If I go out of the network, generally I have to pay a higher copay if I go out of the network. So we want to check our primary doctor. We want to check our specialist. We even want to check our DME, or what's known as a durable medical equipment provider. And those are people that are going to supply us like CPAPs and nebulizers and other things like that. We want to make sure that they're in the network too, because that's going to matter when it comes to your overall savings and the best possible situation for you. Number two is we want to make sure that all your prescription drugs are in the formulary. Matter of fact, if you use what's known as a preferred pharmacy, that's where you're going to get your best discount on your drugs, the best pricing possible. But we want to make sure all of our drugs in the formulary. If they are not, then you're generally going to have to pay full price for that drug, or a higher price than if they're not in the formulary. So these first two, checking your doctors and checking your medicines, are very, very important to maximizing your Medicare Advantage plan in 2024. Tip number three is use all the benefits. I tell this to people all the time that I sit down and meet with, that you need to make sure that you're using all the benefits. Use the dental benefits, use the vision benefits. If you got a hearing situation going on, use the hearing benefits. Most of them have an over-the-counter card that you can utilize to buy over-the-counter items. I tell people pretty much anything you see in a pharmacy that's not prescribed, you can use that over-the-counter allowance to get those things like vitamin C or fish oil or Band-Aids, Alka-Seltzer, and more. So use that benefit. And then gym membership. If your plan comes with a gym membership, use the gym membership, and then you get the idea, and so on and so forth. Make sure to utilize all the benefits, because if you're not using them, then it's going to seem like you're really not getting any benefit at all from the plan. So I want to encourage you to make sure that you know all the benefits of your plan. And this is where it's important that you sit down with a trusted Medicare advisor to help you navigate all the benefits and all the different nuances of your plan. If you do not have someone to help you do that, the number and the website is on the screen. It's also down below in the video description, and either myself or one of our seasoned advisors would be more than happy to help you. And by the way, take a moment to hit the like button for me, subscribe. This helps us help more Medicare beneficiaries like yourself. All right. Now, the last tip here is to use the preventative care. Make sure that you use the preventative care benefit that comes with your Medicare Advantage plan, right? And in these preventative care benefits, you'll get access to certain services at no cost to you. This can include annual wellness checkups, mammograms, prostate cancer screenings, vaccines, flu shots, and more. Take advantage of this, because this could help you be very proactive when it comes to basically detecting health problems early on. There are many people that I run into that are on Medicare Advantage plans don't utilize this benefit, and this is a big pro, especially if you want to detect maybe some early diagnoses early on, is to make sure that you utilize this preventative care benefit that comes with it. And I guess here's a bonus tip. A bonus tip would simply be to use a trusted Medicare advisor that works with multiple carriers. You don't want to use a captive agent. It's not because they're bad. It's just simply because they only represent one company. And so you want to get with a seasoned Medicare advisor that works with, if not all the companies, most of the companies in your area. So that that way it ensures you get on the best situation for your healthcare needs. Because some people may need the vision benefit more than the dental benefit. Some people may need the dental benefit more than the vision. Some people, it may be over the counter and so on and so forth. And getting with a trusted Medicare advisor will allow you to make sure that you choose the right option for you and your healthcare needs. Well, I pray that you got value out of the video today, and take a moment to watch these other videos.